Good night to all. Welcome to Your Health Matters. Thank you for the introduction, Kamal. So I know a few persons might be wondering where is Doc tonight, but he will be joining us a bit late, a few minutes late. Like Doc like to say, persons who are, they might be cooking, you might be watching TV. Welcome, welcome, welcome to Your Health Matters. And we encourage persons to call in so we can make it as interactive as possible. So today we are going to talk about an interesting topic. It's a reproductive organ, female reproductive organ. I'm not involving Kamal too much, but Kamal, you want to take a guess what it is? And I guess not. Okay.
Sorry.
Yeah, go ahead. It's a female reproductive organ. This is the only question for you for the whole night. I guess that's what we're going to discuss.
A female reproductive organ.
Mm-hmm. So we are going to talk about the cervix, specifically cervical cancer. And a lot of persons would have heard about breast cancer, very common, more so than cervical cancer. However, we need to also bear in mind that cervical cancer is a dire issue, especially in the Caribbean region. Before I delve into cervical cancer, we need to have an idea of what we're talking about. Where is the cervix in the body? So the cervix is located between the uterus, or something what we call womb, and the vagina. And it functions basically as a gatekeeper, controlling what enters and exits the womb. So for example, semen would enter the womb. As we know, that's how fertilization takes place with the egg and the sperm. And menstrual fluid, which is what we women would experience on a regular basis monthly, would exit. It also has many important roles in labor and delivery. In terms of it expanding, shortening, to accommodate the fetus, to accommodate the baby. So just of importance, Cervical Cancer Awareness Month passed, and that would have been in January. So it is commemorated annually, every year in January. And in terms of, let's just talk about the statistics, because we're still on the topic of the importance of, not just cervical cancer, cancer on a whole. It's internationally the leading cause of deaths. So in terms of the incidence and the prevalence, specific to St. Vincent, the incidence for 5 years is, that would be from 2020 to 2024, and this data is from the Ministry of Health, 2.95 per 10,000 persons, and the prevalence for 5 years is 14.74 per 10,000 persons. Very fancy. The incidence is basically the number of new cases per year. So that's not factoring the persons who have had it prior. And the prevalence is the total amount of cases for the year. So based on the individual data broken down per year, the incidence has been rising on average from 2020 to 2024, which is alarming. And the most common age group that we are seeing it is 50s to 60s. However, it is known that it is more common among women 30s to 40s, but specific to St. Vincent's data, that's the most common age. So of importance, cervical cancer is one of the most preventable and treatable forms of cancer. So let me emphasize on the preventable, which means that once you take steps that you are supposed to, well, your chance of getting cervical cancer would be less, significantly less, and these include, for example, immunization, vaccines, and also even in terms of the screening, you would catch it at an earlier form where it is more treatable. So prevention includes, as I mentioned, HPV immunization, safe sex practices, and screening for cervical cancer. So the screening tests include Pap smear, HPV DNA testing, those are the mainstay. So it's important to note that persons should avoid intercourse, douching, and using vaginal medicines or spermicides for 2 days prior to the test to make it as accurate. So this is important for everyone to note in terms of what screening is recommended for which age group. And this data is from the US Preventative Services Task Force. So they recommend that for persons 21 to 29 years, they screen for cervical cancer every 3 years with a Pap smear. So the famous Pap smear that is recommended, I repeat, from 21 to 29. And for women aged 30 to 65 years, the option, it varies more. So you can do the routine Pap smear every 3 years as normal. You can also do HPV DNA testing, which is available here in St. Vincent recently, in some of our polyclinics for free. Please take note of that, for free. And the HPV testing, if it's done by itself, that is every 5 years. Remember, we're talking in this age group, we're talking from 30 to 65. And then the third option is a Pap smear combination plus a HPV testing. So it's called co-testing. So those are the 3 options for testing. In terms of the vaccination, it is recommended that persons get vaccinated around our females 11 to 12 years. And the reason for this, we want to tackle the vaccine supposed to prevent you from getting the HPV, human papilloma virus, which is responsible for a majority of the cervical cancers. So the recommendation for this age group is because we want to get persons vaccinated before they become sexually active. So it can go as low as age 9. So persons can be vaccinated at 9 years old. In terms of for persons ideally, that is ideally, but persons can be vaccinated up to age 26. In terms of the schedule, persons less than 15 years, it would be a 2-dose. And if persons are over 15 years, then it would be 3 doses of the vaccine. It's important to note that for the persons receiving the 2 doses, if the second dose is less than 5 months apart, then a 3rd dose is needed. Right?
Doc, can I just ask a question, right? What about the site for parents who might be concerned about side effects? Are there any? Well, I should say, is there anything that they should be worried about?
Okay, so vaccines on a whole, and this vaccine is no different, supposed to, for the most part, not cause side effects, for the most part, right? But few persons may experience side effects, and it's supposed to be subtle. So, for example, like a allergic reaction. So the area might start to swell or get red. Persons may have develop a headache, fever, and these can have symptomatic relief. So, for example, paracetamol for the fevers, etc. So it's supposed to be subtle and not pose an issue.
Okay. So it's nothing life-threatening?
No.
Okay.
Thanks for your question. Okay, so let's delve into, we did a little bit about the stats. In terms of the prevalence, in the US, it is like the 4th most common. Breast cancer would be in the lead. Endometrial cancer, well, uterus and ovaries would be above cervical cancer. But of note, this is why it is especially important in the Caribbean. It is the 2nd most common in the Caribbean region, and 2nd most cause of death. Right? So you see, what I was saying prior with the 4th most common, that's statistics from the US. But in the Caribbean region, it is the 2nd most common. So it's important for us to really tackle this issue. So in terms of causes, we mentioned the human papilloma virus. That's why it's important with the vaccination. And it's caused by high-risk types, type 16 and 18. There are many, many, many different types, but those are the 2 most common ones. And the risk factors for getting HPV includes persons who engage in unsafe sex practices, basically. So having multiple sex partners or the onset of sexual activity. Persons who would have had a lot of pregnancies, because the more pregnancies, obviously, you are very highly sexually active. Immunosuppression, so persons who have HIV, persons who would have received organ transplant, because the organ transplant, they would be on some medication that suppresses the immune system. And a big part of any virus is preventing the spread of the infection. So if the immune system is impaired, then that virus is going to linger longer than it really should. And persons who have a history of STDs. Also, cigarette smoking is specific to one type of cervical cancer. And it's very important, Kamal, for persons to note that it's not just you yourself smoking, but also the company around you. It's almost the same, like a 50-50. Right? So, sometimes you might say, oh, I don't smoke. But when you delve into, further questioning, you realize, oh, well, that has been the rum shop, often with the guys. And
I mean, I don't want to take you off topic, but I think if Dr. Gerald Thompson was here, then I would ask the question, so what if my friends are smoking medical marijuana? I mean, would that but
I would love to hear his input on
response
that.
to but as regards to HPV, are there like signs and symptoms? I mean, I think it's the vaccine is a preventative measure. But what if someone has the HPV? Is it should they take the vaccine? Would it be of any use to them after contracting, or is it something that the vaccine is one that you must take before? And also, are there any signs and symptoms of this disease?
Right. So the signs and symptoms persons might have, but okay, let's start off in terms of the symptoms. Okay, I'll try to remember each of them, right? But the marijuana topic, there is not much strong evidence, but generally smoking on a whole increases your risk of cancer generally. But in terms of majority of the cancers, even especially to the link to lung cancer, it is cigarette smoking, especially because of the nicotine compound.
Okay.
Right. So I'm sure Doc would have a good argument with this.
I could just let you know that he's up.
Oh.
Can you hear us? I know his mic. Your mic is muted.
Okay.
I'm
not
join
the show, but I'm not hearing. Let me go back out and come back in. Sorry about that.
Okay. Right,
okay, so I'll just talk in the meanwhile on the symptoms.
Yes.
Well, you were saying something?
Just the HPV as regards to the questions and signs, symptoms.
Right.
And also whether it is useful taking it after one has contracted or it has to be done before. If it's any use after. Or
after it has been, right. So in terms of the symptoms, it's for the most part, if it's in the early stage, it tends to not have any symptom, which is a lot of the cancers too. So we say it's asymptomatic. Okay. But if symptoms are to arise, common symptoms include, so you might have a discharge, a vaginal discharge that is pus-like in nature or blood tinged, and it's malodorous, right? A very, very, very strong, pungent scent. Then, like I said, you could have a pelvic pain, so hip pain. A very, very important symptom is something that we call postcoital bleeding, which is bleeding after sex, right? You can get irregularities with your periods, so heavy menstrual bleeding, irregular bleeding too, so you can have bleeding also outside of the periods. And then cancer on a whole tends to comprise of something called constitutional symptoms, where we call it, so it's like vague symptoms, right? General symptoms. So you have weight loss, loss of appetite, fatigue, night sweats, those sort of things.
Before we move on, Doc?
Yes. So Tammy, I'm presuming that, and I want to apologize to everybody. I am ably substituted by Tammy. She's doing with Dr. Williams. She's doing a fantastic job.
Oh, thank you.
Let me just say, Now, the symptoms you were referring to,
You. Mhm,
the symptoms you were referring to,
mhm.
are symptoms of someone who has elements of cervical cancer, I imagine, right?
Yes.
Yes. Now, what I want to do, I want to go back just a little bit. Well, I'm sure you've touched on it, that the cervical cancer, the origins of it. I remember in the 90s, we discovered there was this virus, the human papilloma virus, and we didn't quite understand. We didn't quite understand what its relationship was with cervical cancer and warts and so forth. I, as an infectious disease specialist, saw lots of patients with warts, and we tried to burn them off. We tried to do all sorts of things with them. And then some important studies in the 90s started showing the link between this virus and cervical cancer. We know of a few other viruses that can cause cancer, but this was remarkable because this virus not only is responsible for, you could say, 100% of cervical cancer, but is also responsible for a lot of warts and so forth. And there are various strains involved. So I wanted, and the interesting thing is that having the virus, being infected with the virus that will, it could eventually lead to cancer, there's usually no symptoms at all. You know, there can be some of those symptoms you mentioned, right? Even with
Right.
an infection, but usually there's no symptom at all from human papilloma viral infection of the female cervix, the throat, or the anus. And I must say that in a particular sense, because of sexual practices, you know, oral sex, anal sex, that these are other forms of that other than our cervical cancer. I know you're hearing a lot of background noise there, you know, but
We already
I
good.
just yeah, I
But
just-
I'm already good.
and so I wanted to now get back to cervical cancer, but I ask you, Tammy, I know you've done quite a bit of work of it, that it seems as if women of color, let me say black women, seem to be at this higher risk
Mhm.
of cervical cancer. And you've gone through some of the symptoms of why is this so? Why is this the case?
So, well, I just knew, to be honest, in terms of the risk factor that the Black African race puts persons at a higher risk of getting it as opposed to whites or Asians.
Yeah. Well, what I would say, yeah, go
Well,
ahead. I mean, I put that question to raise some alarm, but it's usually because, let me see.
maybe.
Huh?
Maybe.
No, it isn't. It has
Oh.
very little to do with that. It has little to do with that. It is that the taboos. We don't go to the doctor.
Oh, the
We
screening.
are afraid of going to the doctor. And the taboos and the feeling and the mistrust for doctors and so forth. And things like that. I mean, there are people I know, they wake up in the morning and they hear the cock crow and they feel that, well, oh boy, this is going to happen because the cock crow. And therefore, I'm not going to the doctor anymore and things like that. There's strange things like that. So, but at the same time, access to healthcare. If you don't have, in some countries, health insurance, you don't have the money to go to the doctor, you would put it off.
Right.
You wouldn't put it. And if the doctor's saying you want to do a pap smear, especially with a male, you might think, why does he want to put me up on stirrups to examine me and so forth? There's nothing wrong with me. I haven't got any symptoms. And being able to find that there's this virus there if someone is doing a pap smear, in most countries, they're able to do a test for this human papilloma virus as well. There's no blood test that you can do. There's no blood test, Kamal, that somebody could take a blood test and so forth. And
DNA test.
Kamal,
And it is free, guys. It is free in some of the polyclinics.
yes.
I emphasize.
And that's one of the important things. So I just wanted to bring that up. But I attended a lecture just the other day. You had helped organize, and I was really fascinated by the statistics of more Black mortality. And here in the Caribbean, even though the studies have been done more on Black Americans, we are seeing a similar sort of situation here in the Caribbean. So I'm curious to know, how can we go about reducing mortality? How can we detect this early cervical cancer, and how can we possibly prevent it? That's why I want to get at.
Right. So a big part of the mortality rate that goes hand in hand with preventative measures. So there's primary and there's secondary prevention. So the screening that we would have mentioned earlier, that would fall under the secondary prevention measures. And the primary prevention measures would be stuff like lifestyle practices, avoiding cigarettes, smoking, the sexual practices, safe sexual practices, and the immunization. So I think those would play a big part in reducing, and also public education. So not just for individuals to know the accurate information, but for them to also enlighten their peers about cervical cancer and the preventative measures for cervical cancer especially.
So cervical cancer can be dealt with by surgery, It can also be prevented by vaccination very early. Now, if somebody who's 20 years old gets vaccinated, or somebody who's 30 years old, I'm not sure if it's still as effective as if
they recommend is 26 for the vaccine.
The what?
It varies based on different sites would say different things. Around 26.
Yes, but what is the best time to be vaccinated? Because some studies have shown that there's going to be there's virtual prevention if there is vaccination by a certain age.
So 11, 12 is the recommendation. Some sites would say around 9 to 14, but the idea is to get persons vaccinated before. Not promoting all these sexual practices, but we have to be realistic in terms of the world that we live in right now. And the goal is to tackle this vaccination before persons engage in any form of sexual activity.
Yes. And I think that's the important thing. Somehow, once sexual activity occurs, males who carry the virus will infect females they have sexual contact with. And there are about over 200 different strains of this virus. But guess what? There are only a few strains that actually promote cancer. There's the two big ones, number 16 and number 18. Then there's 31, 33, 51, 52, all them kind of things. But strangely enough, there are some strains, number 6 and 9, that never cause cancer.
but they're the most common cause of warts, of vaginal warts, of penile warts. And they not only cause warts in your private area, you can have warts on in your palm of your hand, on the sole of your feet. You can sometimes have warts on your face. I gotta tell you this, I walk around and I might see somebody with a wart on their face, and I could roughly guess that might be a number 7 or a number 9. But those type of warts never go into cancer. You understand? It is the bad boys, the 16 and the 18, and a couple of the others in the 30s and 50s that have a risk of going to cancer. And strangely enough, everybody, I want you to know, your immune system clears the virus, clears it, right? And it clears, if you're infected in 12, 24 months, you're cleared. But there's a certain amount of persons in which these infections seem to persist. And it is where the infection persists that there's the risk for cancer. And if somebody goes and gets vaccinated, it helps with this total clearance, 1, and 2, if they get a pap smear, you can pick up the thing early. And the question I think we got to ask everybody, Tammy, for especially females, have you had a pap smear and an HPV test? Have you had one?
Yes,
And
please.
if you,
I know
right,
it's not
well,
directly to me, but I had to say.
but do you think most people would answer that question? Yes, had one too. Huh?
No, I think the vaccination rate would be poor at present if we were supposed to do any sort of analysis survey.
Yes. Now, when somebody does develop cervical cancer, they say they haven't been going to the doctor, they've ignored, they haven't had pap smears, and somehow they find out that there is a cancer there, which in itself takes some time. What should that person do? How can a person now be handled? What should that person do?
You said that they picked up. Just repeat.
Yeah. What I mean, how should that person approach it? The next steps.
No, repeat the first part. I didn't hear properly the first part. Yeah.
Yes.
Mhm.
Yeah. What is the? I think I'm at the airport, and I think they want me to leave. Yes. No. Yes. So, you've gone to a clinic, and they've picked up that there's something going on there. They've done a pap smear, and the pap smear is showing that there's abnormal cells, looking like cancer. What should a person do? Who should a person go to? What's the next step? And what are the likely surgeries and so forth that might be involved here and so forth?
Right. So in terms of the next step, it's not definitively diagnosed from the pap smear. They would need to do further testing, something called colposcopy, with a biopsy specific to diagnose. So the colposcopy, it uses this thing called acetic acid to visualize the cervix, and based on the appearance, for example, a very white area demarcation with erosions, different things they would look at to determine if it looks cancerous. And then normally a biopsy would be taken from different areas of the cervix, especially something called the transformation zone. That's an important area that they would. So that's at the junction of the cervix going into the vagina. In terms of the treatment modalities, surgery can be offered. So there's something called conization, which is removal of a cone-shaped portion of the cervix. And there's trachelectomy, which is the removal of the cervix in itself. And these are ideal, especially for more early stage diseases. And there's also hysterectomy, different types, simple, modified, radical. So each type would remove, for the most part, the uterus, the cervix, and a portion of the vagina. And sometimes lymph nodes may be removed, especially if the cancer has metastasized to the lymph nodes. So that's one form of treatment, which is the surgical treatment. And then there's also the medical treatment, which would be chemo, well, for locally advanced diseases in particular. The preferred option is chemotherapy and radiotherapy combined. However, you can give chemotherapy separate and radiotherapy separate as well. And when it has reached to a very fast stage, in particular around like stage 4B, then that option for, well, I should say the treatment option is mainly palliative care. So more than likely that patient is not going to survive. So it would just be mainly like palliative chemotherapy, palliative radiotherapy. Also, there's something called pelvic exenteration, which is a very, very massive surgery. This is for when the cancer has reached a very, very, very fast stage. This will involve removing pieces of the urinary tract, so like even like the bladder, even the rectum, and those sort of areas. And it carries a very, very poor morbidity rate and prognosis on a whole.
But tell me, that sounds really serious, you know. Going from once that biopsy has been done, and I know what you've described, I think can probably scare a lot of females. But cervical cancer is something that really can creep up on you. And, you know, from what you described as some of the early stages of the cancer, there are things that can be done, taking off a piece of the cervix, taking out the womb. And then when you talked about the more extensive spread, taking out a whole set of organs, the bladder, the this, that must be really disconcerting. And you even intimated that there are going to be some stages where it's so advanced, you know, you could say there's no point doing anything. You know what I mean?
Right.
But the chemotherapy, I have lamented, and it's my hope one day that St. Vincent will be able to offer what we call radiotherapy. It's a very expensive.
It's there.
It's a very. Yeah?
It's there. My hope too. It's coming.
Yes. It's very expensive to set up and so forth. But you know, everyone, there is surgery. You can remove the cancer. That's one thing. Then chemotherapy. You can, you know, hit it with chemicals that are going to get into your blood and go to the site, and hopefully the chemotherapy will kill some of the good cells, but you also expect that the chemotherapy would kill the bad cells too. And you can sacrifice some good cells being lost by zapping, by not want to use the word zap, by really poisoning these bad cells, but you will lose some good cells too. That's why with chemotherapy, a lot of people's hair drop out and other things like that, because the hair follicles in your skull, they can't tolerate the chemicals either. But you sacrifice in that way. In order to live, you prepare to lose some hair for a period of time and become bald, you know?
Right.
And then radiotherapy, this is where you use the word zapping. You can zap the cancer, focusing the radio wave. And sometimes, and in most cases, all three of these things may be required. Sometimes they use radiotherapy first, then chemotherapy, then surgery, and all things like that. And then there's all sort of combinations. So it's very, very complex. Tammy, I don't know if we open up the lines, if anybody wanted to ask any questions. This is a complex issue. Look, you and I are going to be talking about this, you know, for the evening. But remember, everybody, 457-9997. Cancer is big, whether it's breast, whether it is, you know, the lungs, whether it is in the liver. Cervical cancer, I imagine in St. Vincent, is probably about one of the big three for females.
Yes.
You know,
More
it's the
than
second most common after
Yes.
breast cancer.
Yes.
You know?
For females, yeah.
Yes. And what I don't know if anybody has any question to ask, but you know, Tammy, I am. Oh, God, Tammy. I got to say, Doctor. Yeah? What would you say
Mm-hmm.
is the recommendations you would give to a young 20-year-old individual? You know, what would you tell them?
Okay. So
He said, I hate to do this, but I'm gonna leave you to finish off the show. Look as if I have to leave. I'm spoiling things, but I'm gonna leave you to wrap it up. And so, okay?
okay, sure, Doc. Thank you for coming on.
My pleasure. My pleasure.
Okay. So a young, like Doc asks, a young 20-year-old. So, you know, Kamal, sometimes, you know, you want to play big and bad and, oh, this can never happen to me, that kind of thing, right? As we get old and we mature, right, we should realize that anything is possible. And especially for those persons who have a family history of cancer. For the overall public too, right? But especially for those persons, it is very important for them to do their checks, get the screening done early, and take whatever preventative, because screening is like I said, a secondary prevention. But if we could even tackle the primary prevention, which is the vaccine itself, because that confers a higher success rate of preventing HPV infection, which is responsible for majority of these different types of cervical cancer. So if we can do something to prevent us from developing cervical cancer later down in the future, why not take advantage of this opportunity? That is the question I would ask the young females.
All right, we do have a question here on WhatsApp. This person is asking, do radiotherapy damage the DNA in cancer cells?
Yes. So essentially, radiotherapy is supposed to destroy the cancer cells on a whole. And like Doc was mentioning, even with chemotherapy, it not just tackle the cancerous cells, but also the normal healthy cells, right? So that's why sometimes even like the red blood cells, right, which is a big part of that would give us the energy that we have. So once that is affected, that's why persons would also be fatigued and tired, and they may develop further complications like infection because the white cell is being affected as well. And the white cell is responsible for fighting off these infections.
So if you're using something like that, a therapy that damages the cancer cells, of course, which we're happy about because we're trying to get rid of them, but they're also damaging the normal cells. How effective would you look at using radiotherapy?
Right. So it is just, this is how I would look at it. You have to get the therapy if you want to cure the cancer, right? So it is a must in some cases, right? If you leave it without the therapy, it will just continue worsening and increasing in its stage. Is something called Figo classification that we use specific for cervical cancer. And ultimately death, more than likely, right? So it's important for us to take the relevant medication, which is the chemotherapy, whether it may be chemotherapy or radiotherapy, and sacrifice what should be, some person experience it more severe than others, but the minor effects of the chemo or the radio, like I said, some persons would have more severe effects, right? So it's like is weighing the pros and cons. There are more pros than cons. Right? So it's just something you have to get over. And even with the side effects, there is symptomatic treatment that we can give for some of the side effects.
Right. I noticed in the conversation tonight between you and Doc, breast cancer came out. And we've been talking about cervical cancer and the use of a vaccine to help prevent. And these illnesses are more towards women, although we know in men you have prostate cancer, right? But as regards to the breast cancer, and that in itself having a high rate, I think, what is being done as regards to the breast cancer is what should women do? We know if you have the HPV DNA testing, we have the virus for the vaccine for that. What about breast cancer?
Okay, so breast cancer.
I don't want to take you off topic.
No, that's okay. Okay. That's okay. So breast cancer is the leading cause of cancer deaths in St. Vincent and the Grenadines for females, right? And it is also the most common cancer for females in St. Vincent and the Grenadines, right? So that is even above cervical cancer. It's very, very, very rampant. Even persons we are finding these days, they are getting breast cancer at a younger age. And we have to question why. What exactly is it? Is it something as minuscule based on the statistics? Is it the contraceptive pills? Well, family history, we know that is one. But is there something we're missing from the diet? You know, we have to really do question what is really going on, because is it a product that we're using? Is it also too, we find cancers are prevalent in persons of certain occupations like farmers, right? So all these things, these questions that I'm asking, these will factor in as preventative measures, not just for cervical cancer, but also for breast cancer and all the other cancers. But specific to breast cancer, I would advise the females to do a monthly breast self-examination. So you are looking for you're looking to see any changes in textures in the breast, right? You're looking to see if the nipple is inverted. Is there any discharge coming from the breast? Is it look at the general appearance. Are you seeing like a dimpling appearance? You know, like an orange, the outer side of an orange, how it have like some small pores in, right? Does it look like that? All these, is there a change in the color? Is it red, purplish, you know, anything off than the usual? And then when do we feel any lump? It's also important for us to feel underneath the armpit too. And that would indicate to if the lymph nodes are infected, because they could be swollen. But it could be swollen for other cases to like infection and so. So it's very important for the breast self-examination and the mammograms every 2 to 3 years, of course. I would advise persons generally, please go to your doctor annually at least, at minimum. And specific for breast cancer, please get your mammogram checks every 2 to 3 years, or as recommended by your doctor, your healthcare provider. So there's also something called ultrasound of the breast, right?
Okay.
That so it is not the first choice, ideally mammogram, right? But sometimes in resource limited institutions, they may only have the ultrasound available. So in that case, then the ultrasound should be used, right? If the mammogram, they don't have access to the mammogram and other tests. Normally the ultrasound would be requested if there's an abnormal finding that shows up on the mammogram, right? So it's always best to have 2 tests that, you can compare the results with.
Okay.
But the definitive diagnosis for breast cancer, as again with any other cancer, is a biopsy. So you have to sample a piece of the tissue and send it to the pathology lab for them to do their inspections, look at it on the microscope, check the cells, and then they would come up with diagnosis of, even the type of cancer, etc.
No, you just mentioned something, and just like men, I am sure when you mention certain procedures, and then people might want to, women, let's say women now because I'm a man, might want to shy away from the doctor. So a procedure where a biopsy, is it a painful procedure?
So it depends on it. So any procedure, just put it out there, pain is a risk factor, right? If you're doing a biopsy, you're piercing the skin, right? So that could involve, like I said, remember, it's a risk factor. So you could feel pain, but it should be minimal. Because what the doctors would normally do is they would inject this medication before they actually take the biopsy. And that is basically, we would say in layman term, to numb the area, right? To make it less painful before they go through with the biopsy. And normally it's a fine needle biopsy.
Okay.
But there are other forms of biopsy that can be done.
Do we find many?
But the point is it should not be painful.
Oh, okay.
Right? And if there is pain, there there are
It's
things,
bearable.
there are pain medications as well that the patient can get, whether it's IV or what's not. But the numbing medication should help.
Okay. Is there a situation in Simmons? I don't know if you can answer this question.
Sorry, just for correction, there's also core needle biopsy. I think that's, well, you see, I'm not a surgeon, but I think that one is the preferred one, the core needle. But there are different types of biopsies that can be done. But you're asking.
Oh, okay.
Before we wrap up, we have 4 minutes.
Well, the thing is about it. I mean, some of the jargon that the doctors use, the average person like me, I wouldn't understand. And stuff like that. But I mean, like for St. Vincent, do we find a lot of women going to? Is it recorded that a lot of women, they come to do the necessary checks? I mean, I know for men, and as they would say, men pretty much shy away from doctors. So you have a tendency of more females going to the doctors. But as regards to cervical cancer and breast cancer, do we see a lot of women coming forth to do necessary checks to find out, whether this is or not?
Right. So I am not 100% sure, but I don't think we have specific data at present to demonstrate like the actual value of woman. Say, for example, how much women come for pap smear, or like analyzing that data. right? I'm not aware. Maybe there is, right? But I would say that generally from statistics, women tend to seek more routine checks than men. Men tend to only go to the hospital or any medical institution when something goes terribly wrong or emergencies, right? That's something that we really need to change. So I would say it would probably be high for women. But however, there are certain things, it depends on what it is. If it's like mammograms, I would say yes, it's high, especially in terms of it being in, at a subsidized cost. But certain things like vaccination, I think that is still a big issue for a lot of persons in St. Vincent, especially in terms of trusting the vaccination. But we need to be, we need to remember that these vaccinations normally, especially the ones given at birth, etc., and the first few years of life, they would have done immense research over periods of years, evaluating the efficacy of these vaccines and possible side effects, etc. So it's important for persons to know that these vaccines are safe.
Okay. Well,
but I'm not getting into. I would have preferred Dr. Thompson to tackle that.
All right. Well, we have just about 30 seconds remaining in the program, so I guess there's
any more questions?
Well, within 30 seconds, I guess there would be some sensitization done. I don't know if there's plans to try and sensitize people to get more people to come in, at least get vaccinated, or at least find out what their status.
And then sometimes to Kamal, it's just a simple of knowing, and a simple matter of knowing what to do, where to go.
Or is it that people just don't want to know?
It could be that too. But for some persons, for sure, they would say, "Oh, I didn't know that was free," or "I didn't know you could do that there." So it's very important for us to educate persons and about what is available, the services available for them to utilize, and also empower individuals to take charge of their health so that we can live longer, healthier, and I must say happier life. Because I would also emphasize that mental health is a big part of health, right? Happier lives, right? So it's important. On that topic too, stress is a big risk factor for cancer. So it's important that we tackle that. And I think that one very important way of tackling that is having robust psychological and psychiatric supports in place.
Thank you very much, Dr. Williams. And that has pretty much brought us to the end of Your Health Matters here on WeFM. This evening, we had Dr. Tammy Williams, and we were also joined by Dr. Gerald Thompson for Your Health Matters here on WeFM. Dr. Williams, we want to thank you so much for being here. And folks, and just
thank you, listeners, for listening to me and Dr. Thompson and Kamal. Thank you.
You're welcome. It is now time. Just to remind you that Your Health Matters was being brought to you with the kind compliments of People's Pharmacy.
People's Pharmacy for all your pharmaceutical, skin and body care needs. Located on Gren